A transfer to the Heart and Kidney Unit at Children's National is an exciting time. Your child is getting better, and we are the unit that prepares you to succeed at home. The Heart and Kidney Unit, or HKU for short, at Children's National is part of the progressive and comprehensive care for our cardiac patients. You will notice some differences between the HKU and the CICU. Because your child's recovery is progressing, they no longer require one-on-one care. Nurses on the HKU care for more patients than on the CICU, but rest assured, the medical team will continue to provide top-notch care for your child. Another difference from the CICU is your child may share a room with another patient. We ask that visitors, including siblings, are mindful of patient privacy and visiting hours. Visiting hours are from 10 a.m. to 8 p.m. Siblings cannot spend the night in the patient rooms, but parents and legal guardians are always welcome. Most importantly, on the HKU, the nursing staff will teach you how to care for your child and help to build your confidence as a caregiver in preparation for returning home. A typical day may start with a morning chest x-ray.
Just going to take a picture of your insides, okay?
Next is lab collection. Many patients on the HKU will have blood drawn in the morning to provide the lab information the clinical team needs to create their care plan for the day. Pediatric phlebotomists perform the blood draws.
It's going to be a little ouch, okay? 1, 2, 3, and ouch, okay?
We know it's never fun to have labs drawn, but it is very important to get these values so we can best care for your child. After morning lab collection, vital signs will be taken by a patient care technician. They typically measure heart rate, blood pressure, temperature, and oxygen level. How often we take vital signs will depend on your child's needs. Nurses and physicians will also perform physical assessments throughout the day. Rounds on the HKU may look different from rounds in the CICU. If your child had surgery, they will transition to the CV surgical team on HKU, and the cardiovascular nurse practitioners, or NPs, will manage day-to-day care in partnership with the surgeon. Our NP team meets every morning with your child's surgeon to discuss your child's progress and plan of care. Later, the NP team will come to your bedside to update you on any changes or answer any questions or concerns you may have. The team may be smaller than in the CICU, but our NPs are specially trained to manage the care of children after heart surgery. If your child did not have surgery but was in the CICU, their care will be transitioned to the cardiology service, managed by our Heart Institute cardiologist. This team will round daily on your child and ensure you are updated on their progress. Recovery can take time, but if your child's transfer from the CICU to HKU is not progressing as you or your child expected, feel free to discuss your situation with any of the care team members. There are a few key staff members on your HKU care team: bedside nurse, charge nurse, patient care technician, and patient service associate. The bedside nurse is the nurse caring directly for your child and will work to help you feel comfortable about caring for your child once they are discharged. We encourage you to ask your bedside nurse questions about the plan of care. If you have questions for the medical team, your bedside nurse can help you with that as well.
So if I'm going to be using 5 mLs or more, I should use the bigger syringe.
Exactly. A rapid response team will come together to triage a patient to a higher level of care whenever necessary. Please ask your bedside nurse for more information. Charge nurses typically do not have a patient assignment and are here to facilitate service and safety. On the HKU, patient care technicians, or PCTs, assist nurses with vital signs, baths, and feedings. There is one PCT assigned to observe the central monitors and alert nurses to any alarms that may require their attention. The monitors in the HKU are the same monitors that were used in the CICU. If an alarm occurs, the system records it so that it can be reviewed by your medical team at any time. Often, alarms are caused by your child moving around and may not be a real issue, but here in the HKU, just like in the CICU, we take every alarm seriously. The patient service associates stock supplies for the unit and may also assist in delivering food to your child. You can call the PSA if you would like a bed change or fresh linens, if you need more diapers or supplies, or to request water refills. Each room contains whiteboards with the names of your care providers and how to contact them using either the blue in-room phone or your personal cell phone. Your child might be sore after surgery. On the whiteboard, you, your child, and the bedside nurse can discuss what level of pain your child is in and how it affects the goals of preparing to leave for home. We understand that when a child is sick, the whole family is affected. The HKU has resources to make sure you are kept informed, as well as services to care for the entire family. Your care team also can direct you to additional outside resources and support groups. You may have met your social worker in the CICU. They will continue to follow you and your child on the HKU.
I just want to reassure you that I will still be checking on you. You'll still be seeing me while you're out here.
Child life specialists are available in the HKU to help you with developmentally appropriate play for your child. They also help to comfort patients during procedures.
Hi, my name is Dolly. What's your name?
The playroom is a safe zone for children. There are no assessments, medication administration, or procedures done while your child is in the playroom. You have access to the Get Well network from your bedside TV. This interactive service offers not only entertainment options, but provides patient education and health information. When you get hungry, the hospital has several options for you to choose from, including our second-floor cafeteria, the seventh-floor cafe, in-room restaurant delivery, the coffee bar, and the store in our atrium. Here in the HKU, it is okay to eat at your child's bedside.
Thank you, Dean.
From the break.
As we mentioned, one of our main goals for your child's recovery is preparing you to be comfortable providing care for your child when you leave the hospital. Once that day arrives, your bedside nurse will review with you a step-by-step checklist for providing care at home. They will also ensure you have contact information for your child's care team in case you have any questions. Healing takes time, and here on the Heart and Kidney Unit at Children's National, every member of our team is dedicated to making sure your child gets better and that you are successful caring for your child at home. Welcome to the HKU.